Welcome to Beyond the Press Release, our production of Gorecom, in which we take the time to speak with small cap executives after they put out important news. With us today, happy to have him back because it's been a while, but for very, very good reason. Andrew Morton is the CEO of Bloom Health Partners. You may not recognize that name. Why? Because they're formerly known as Maitri Health Technologies. Company now trades on the stock symbol BLMH in Canada, MHTCF in the US, and D84 for our friends in Europe on Frankfurt. Why does the company have a new name? July 2nd, they signed a definitive agreement to acquire Bloom Health for $20 million. And on October 28th, just last week, they announced they're changing their name to Bloom Health Partners. One thing you need to know about Bloom, and then we'll get into the conversation. They're a trusted occupational health and safety service provider. They offer a network of top healthcare professionals and integrated labs for who? For Fortune 500 companies, Hollywood productions, and major sporting and music events. And more than just words, they're not just talking the talk, they're walking the walk. And here to discuss is Andrew. Welcome back, my friend.
Hey, great to be here. Thank you.
Man, $20 million acquisition. That's going to be one of the biggest ones we've seen in the small cap markets in the last couple of years. Before we get to the details, how does this change the company to bring Bloom in and now create this one unified platform?
Great question. It really, truly, it helps us as a company now fulfill a lot of what we set out to do, year and a half ago or so, when we really got serious about this with Maitri Health, when we launched the business. This now gives us a complete offering. We'd always been serious about technology, a technology platform, but clinical services and lab services, which is essentially what we get from our acquisition with Round Hill Health Partners, which was called Bloom. The whole concept with this was now we're able to bring all the things we tell companies we could do. We can bring them complete services. We can help them with health management, outcomes, and data. But now with a clinical component, it does a couple of really big things for our business. One is it gives us the ability now to offer a complete suite of services, but it also gives us a data access point. So for example, when a company is doing a lot of COVID testing, which is what people are doing today, a fair bit, well, now they have, in for lack of a better term, an in-house lab that they can call their own, even though it's us, to be able to track the health and safety of the organization. As we migrate to and fulfill our promise that we made to our investors about having a long-term business and a long-term health system, well, that now morphs into occupational health. But because there's a technical platform, George, the idea now is it's Occupational Health Tech, which is truly a new category. And we're the first to talk about this, and it's sorely needed. And then, without a doubt, in my mind, the perk of the next, we'll call it decade, is really healthcare. COVID, as I've said before, just put a big light on all this as something that's needed.
You want to attract great talent. Healthcare is going to be a really big part of that, right? Providing a soup to nuts solution for your employees. So to clarify for people at home, or to further drive the point home, this is a B2B platform, right? Essentially, you're going to, for example, President Biden in the U.S. now has a mandate. Any company with more than 100 employees has to have them all vaccinated. That means someone's got to track all that. You can't just assign that to George and say, hey, go track all that. Right up to Fortune 500 companies who have to have even more than that. They really have to have a lot of transparency. They have to have a lot of compliance because they got to. So 3 years ago, we might have thought, okay, sounds interesting, but sounds kind of boring. But today, it's necessary. And you guys are one of the first companies out there, right, to really go to B2B big companies and say, we got the whole platform unified for you.
Absolutely. The concept of occupational health is not new. It's been going on for a long time. One of our board members that we added, we did a little bit of a shuffle on our board. We added 2 new board members. One of them actually came out of Johns Hopkins, and Dr. Nimisha Kalia, and she's now at GE. She's actually the chief medical officer at GE today. But while she was at Johns Hopkins, she structured occupational health for big corporations. That's what she did. It exists today. The difference, though, is that we're bringing an intelligent approach to all of this, meaning there's data. It's a data-driven model. I sat with a CEO about a week ago here in the US. I'm actually down here this week dealing with some of our offices. So I'll be back up in Canada, hopefully Friday, if all goes according to plan. And the CEO told me flat out, he is now competing with Amazon for talent, right? It was never a problem before. So if he can offer a perk, which is healthcare, and give that to them as a model that will now attract employees, well, now he's got something to compete against Amazon with as an employer. When you've got tens of thousands of employees, this becomes a real issue. And the Great Resignation is very real this year. That's very well documented. But the other challenge is getting a larger labor force to come to work. And how do you attract that talent? And the feeling among big CEOs I've spoken to so far, in this journey has been unanimously, find me something that attracts them. But at the same time, if you can give me a predictable model where I know the health and safety of my employees and my workforce, and I have an idea of how much longer I've got with them, or are we doing things to keep people on board a couple of years longer because we're keeping them healthier and happier? Well, then we've achieved our goals. And for them, it's got to be that way for them to persevere over the next decade or so, because they're going to need to have this just to compete for talent.
Yeah, and what I love about, as a shareholder, the revenue side is you're not competing for one George at a time and one mayor at a time. You're going into a company, GeorgeCom, who's got 400 employees or 4,000 employees or 40,000 employees, and you're the all-in-one solution, right? So give us an example of what the revenue model looked like. I'm GeorgeCom Industries. I've got 6,000 employees. I call up Andrew Morton at Bloom or your biz dev team and say, guys, deliver this to me, so that everyone at home can really understand. What are you delivering to GeorgeCom Industries now?
Great question. So billable services flat out would be around the clinical services, because there's a real spend for that. But then on top of that, there's a SaaS business for the software. And this really gives them the ability to manage things near term. In a lot of cases, people are coming to us right now because of the Biden administration's announcements around the 100 or more mandate for vaccine testing, or both. Okay. Well, we can help them manage not only the number of tests that are happening and what the safety condition is, but also help them manage with an unobtrusive, kind of non-passport-like discrete method to manage who's been vaccinated, who hasn't. So, we're not their lawyer and not giving them policy. We're just giving them the tools to create that policy. But that's a billable service as software. Okay, so that's two big components. The third large component here is advisory services. So there's three different revenue models. And on the advisory side, we have a really strong panel of researchers that are releasing data on predictive outcomes, so then they can start making some smart decisions. Because when you've got 6,000 employees, there's a really good chance they're in more than one territory. So each of your geographies, you have to start thinking about it a little bit differently.
All right, so you're going to be able to bring data to my business, give me predictive analytics, so that, hey, George, giving you a heads up, George of GeorgeCom Industries, you got to be looking out for this. Let's get ahead of this.
Absolutely.
What does the revenue model look like, Andy? When you walk into, GeorgeCom, I'm just going to use that because it's a name that, we can't get in trouble with. Even then, it's not as if you're saying, okay, George, whenever your employees show up, we'll just bill you. I'm assuming that it's all right per employee. You get this, you get a package of services at a minimum. So when GeorgeCom comes onto the Bloom platform, is it one big revenue? Is it a big revenue win, a big contract win right off the bat, and then they can always add on to it? But I'm assuming they get some kind of package per employee, and you multiply that out.
Great question. So some of our better clients today, we started small, because you always do with big clients. You don't just walk in trying to boil the ocean, and they're looking for a couple of services. And we proved ourselves. And we've actually walked in a couple of cases, where they had some bad experiences, the previous provider, in some cases, poor lab practices, that kind of thing. And unfortunately, the lab space, there's a lot of questions around, some of the individuals that have opened up around labs. Things happen very fast with COVID and a lot of that. Not a lot of people really can make this migration to occupational health, because we do have a very heavy clinical and lab base. Our science team is excellent, and I would say world-class. And what we do is we'll typically come in and we'll sell a couple of services. For example, one of our big occupational health clients that we're working with now, one of the things that they've been talking to us about is, look, you guys did such a great job when we needed you to keep our workforce working during some really dark times, and we saw you in crisis mode. That's the kind of provider we want to help us with occupational health. Somebody that's going to be there through thick and thin, and then builds, so then maybe it's some, I wouldn't want to call it fee for service for labs. It's more, how much testing we do for them for various kinds of, ailments and that kind of thing. But then we layer on more kinds of services. So maybe they start with workers' compensation only. And then they eventually evolve that into other things like, okay, well, now we want to screen for certain cancers one day. And we want to be able to check our diabetics and those kinds of things. Well, in there's nothing in there that says COVID. COVID just is one of many conditions that they're going to want to think about. The pandemic is very real, and it's taking a lot longer than anybody expected for it to work its way through. And I think COVID testing is not going to go anywhere, and it's going to still be a good component of our business, and it's high volume. But at some point, these organizations, psychologically need to move on because they need to think about how do they attract employees. So these services become part of that. Then the software we layer on top of that, and it gives them the ability now, and it's a revenue line for us and a huge value for them to have intelligence on the overall health and safety of their workforce.
You didn't make this acquisition for $20 million. I mean, that's a major $20 million US. That's a major acquisition. You didn't make it based on just potential and synergy and all that. Bloom Health has some pretty healthy revenues right off the bat. So can you talk about that? And then if you can, talk about its client profile. If you can't name them specifically, let's talk about the type of clients that they are. But first, let's talk about the revenue that Bloom Health already has on the books.
Sure. Well, first half of the year, we did do a business acquisition report that's filed, and that's open for anybody to have a look at. It's a healthy business that we came into with a really good client profile that we're now able to add to the mix of things that were part of our original business. Within the revenue model, if you look at the types of clients that we're getting ready to announce, because there's some we're getting some permission, there's some sensitivities around it. They're large companies, but movie studios, you mentioned already, Fortune 500, actually Fortune 50 to be more specific, some very large ones.
Wow.
Done some airlines. We've done some stuff with some major entertainment companies. We did some stuff with major sporting events, and I'm pretty excited about kind of what's to come in that area. I mean, that's all very real business. And the big one is we've not had a situation where a client was unhappy with what happened. They've all been thrilled. And in many cases, Bloom, it's somewhat unglamorous how Bloom won some of our business in the first place, in the original business that we acquired. That literally walked in and picked up the pieces from some folks that just were not heavy enough on the science to understand truly what the client needed and really have good lab practices. I say that, quite complimentary of our team because we have a really strong lab team. And our science team is excellent. And we're now recruiting even more clinicians as we really expand out into more clients that we can talk about. Right now we're talking to some large corporates that are turning to us saying, look, we have a very large population of people that are not vaccinated, but that just solves today's problems. We're looking for a long-term health solution. It's not just vaccinations, it's everything.
Yeah, and that obviously gets you in the door, right? Because that's something that they have to solve right now. So you show off your capabilities and then say, we need more, let's talk to you. By the way, sorry, are you able to provide a revenue number that Bloom Health was able to generate in the first half of the year?
It's filed, and we're going to be talking about that here shortly as well. It's unaudited numbers. This is a business we acquired.
Okay.
But there's some good reasons why we did what we did in terms of acquisition. But what this really brings us is really a completion of what our strategy has always been. Which is data points, which we really came from the data side. I myself come out of the tech world. That's my background. Our CTO, as you remember from interviews we've had in the past, comes from a heavy data component. That's what he does. We now have a really strong team that we brought on. We've actually added a chief marketing officer who came from the acquisition, and we just liked his capabilities. But he came out of Life Biosciences, some other biotech, and understands how to position this to the B2B market, because that's specifically where we're going with this. And we now have, as a result of this, we've got now, I would say, the best board I've ever worked with. And back to your question about numbers, all of this really supports the value of the business that we saw. But to me, it's about the potential, because the growth opportunity is tremendous. This is an underserved market. Go ahead. Please.
The good news is it's a massive market.
Yes.
And you guys are almost a first mover because of how you've set the company up. But the challenge also is, how do you get out to a mass market? Because you got to get, how do you get in front of all the Fortune 50s, all the Fortune 500s, even the Fortune 1000s, right? And all the other smaller businesses. So first, let's talk about how big of an opportunity you think this is, because it seems like this industry is now going to blow up because companies want to both, like you said, health is going to be the new perk this decade. I 100% agree with that. Mm-hmm. So how big of a market do you think this is? And how do you go after it, Andrew? Like, do you do traditional direct sales force? partnerships, online marketing to reach every health officer across the country? How do you do it?
It's interesting. I find the doors tend to be open to us. And I think it has to do with our capabilities thus far. And we have some referenceable customers that are willing to vouch for us. So that's been very helpful. But it also helps to have a very well-connected board and advisory where they definitely have really, if nothing, understanding of the right kinds of clients for us to spend our time with. I mean, you can't be everything to anybody in any business. Doesn't matter what the business is. You have to be focused. And with the very least, with our board of directors and our advisors, we do know, where we should be spending our time. And we do have a very aggressive sales force that they're very intelligent. Our business development's, very strong, comes, very well experienced. But at the same time, because we've done so well with movie studios and some Fortune 500s, that lends itself to the next one. It's sort of like the first customer is always the hardest, and they get easier after that, no matter what business you launch. We've already got those first customers. It's already there. Now it's scaling it out and continuing to add capabilities. And what I'm amazed with in terms of talent that we're able to bring in to make that scalability happen is that there are a lot of people who come out of healthcare and other parts of the industry that recognizing that this is an industry that needed a little help. I don't want to say it was broken, but no doubt, if nothing, the pandemic we've been going through, and we saw it essentially started in March of 2020. All of that was really all it really does emphasize, amplify that there's a real issue around, how healthcare is delivered, how data works, the records, how people are managed, how safety is managed. There was no thought to that. The supply chain thing was something we did very early in our business and when we first launched our business. But it was really a gateway to a much bigger thing that we recognized that we could disrupt. We're not trying to compete with hospitals. We're really augmenting their capabilities.
Yeah.
And it's really at the workplace. Employers welcome it. Employees welcome it. Insurance companies welcome it, because for them, all of a sudden, the insurance, especially in the United States, where health insurance is extremely expensive and extremely difficult to predict now that data models are all upside down because everybody stayed home for the last year and a half. How do insurance companies even put a number on what an insurance group plan is worth? We're going to give them the ability to do that. So it really helps a lot of different parties that need a new kind of system for large employers. In Canada, we talk about, a big employer being, 5,000, 6,000 employees. In the United States, a big company is like 50,000 employees. It's a different game.
It's a 10X.
Yes.
I know it's early because you signed the definitive agreement in July. You just did some rebranding now, but are you able to let us know if you've had some early successes talking to companies? And I know you can't be overly specific if you have, because you haven't press released it, but is it fair to say that you guys have hit the ground running, and what kind of feedback are you getting from the biz dev side?
George, great question. So we made the definitive agreement. April 27th was when we announced that. Just to be clear, July 14th was when we closed the transaction. So that was kind of, so July 15th was really our first day together as colleagues. Okay, we'll say. We haven't made a lot of noise in the press since then because we just put our heads down and executed. And that was acquiring new customers. We have definitely hit the ground running on all fronts. We definitely have some good customers that I'm really excited to talk about. There's been some very unique, interesting wins, and that's going to continue. So very excited about that. And it's really been about just execution, and I take the advice I get from mentors very seriously. And they all said, okay, you've now done your transaction. Now you have to go out and prove it. Now go earn it. Go show the market.
You don't celebrate the acquisition. The hard work begins with a lot of people think, oh, we got this acquisition, so we're set. But the fact of the matter is, that's when the hard work begins, and you got to go prove it, and you got to go get those wins, right?
It's all about execution. Yeah, and the exciting thing is we have plenty to celebrate around that when the time comes.
Last question for you. You brought on, we talked off screen a little bit about the great people and the pedigree that are now part, and I think that's a huge third party credibility for you guys. Talk about just some. I know there must be a lot, and I know you can't talk about everybody, but talk about some of the great people and titles and pedigree that are now sitting around the Bloom table.
Without question, I think I have to start with my board because, like I say, world class. I mean, this is the best board I've ever had. And so we've got Sav de Pasquale, who's former GlaxoSmithKline. He did various roles there, including CIO at one point, and that's our chair, which is just fantastic. Jessica Federer, former chief digital officer from Bayer. She's currently a VC partner in Boston, one of the major VC funds in biotech and health life sciences. We've now also got Dr. Namisha Kalia. She's currently the Chief Medical Officer at GE, former Johns Hopkins. She's also an MBA. She's also a number of other things in addition to being a doctor, which is just an incredible person. John Garcia, former Chief Marketing Officer from Sprint. So that's, I mean, to me, that's an incredible amount of bench strength for a board to sit on. I'm honored to be.
I don't think I've ever seen a board that strong in the Canadian small cap space. And I've been around for 25 years. I don't think I've ever seen a board that's with that kind of Fortune 500 or Fortune 50 kind of participation. It's unbelievable.
Incredible amount of talent, and a great group of people to go to, for guidance and frankly, just to look at his peers and talk a little bit about, am I making the right decisions here? Is this the right direction? And I think our business plan truly is what attracted all of them for different reasons. On our advisory, we've still got Dr. James Shepard. I mentioned him in the past. He's at Yale Medical Center. He works at the WHO, easily one of the biggest global experts on epidemiology. He works very closely consulting very large companies on a global scale around just dealing with the COVID, but then go forward, he'll help us with the flu. He'll help us with other ideas around consultation. Eric Hargan's one of our advisors, former the Health and Human Services Director for the United States government. So he reported to the president in that role, when he was part of that.
Unbelievable. I almost think you're lying, man. It's
a lot, and there's some more, there's a lot, it's what's humbling for me is that, as a leader, I get this honor of having these folks I can turn to and I can pick up the phone and ask, hey, what do you think about this? Is this the right way we're approaching this client? Or are we barking up the right tree for these kinds of services? Because as we get into Occ Health, I mean, we're getting beyond pandemic and all that, which is still, I mean, frankly, we're probably another 12 to 18 months of testing at this kind of volume globally for all everywhere, but just because of the way it's all working. Variants are happening, there's breakthrough cases, it's all very real. But that being said, as we migrate into Occ Health, it's not just about offering Occ Health on site and obviously a really solid digital platform that gives employees and employers a real window into the overall health and safety of the company and predictability. But it also, because we're there and because we are innovators and disruptors to a certain degree, we can bring in new technologies, new ways to screen cancers, which we're finding, new ways to do, on-site things like ultrasounds and x-rays and that kind of thing. So if an employee has some kind of issue, they don't necessarily have to leave the workplace. The employer is more productive and the employee is a lot happier. So that gives us a big opportunity. So I turn to our board on a regular basis and say, hey guys, is this right? Is this going to work? And am I going to be proposing something here that's actually going to provide value to the client? So I'm very lucky in that regard.
And they've got Rolodexes. I mean, it's not that they're there for biz dev, but man, these guys have Rolodexes where they can reach out if and when necessary.
Yes, yeah, definitely. No, we definitely have a well-lettered board, and our team's the same. We are the core team, same leadership. It's really the same structure on the board level and the leadership. We're still, I'm still the CEO. I come with a heavy tech background. Our CFO is very strong in the capital markets, so we definitely have the diligence portion and governance under control. Our chief technical officer, he's had excellent experience in the data world, having sold one of the largest websites back to Wix back in 2017. And so on. We have just an excellent team, good operations. We're very strong in a number of areas. And now we're building bench strength to make sure that the foundation is strong because we're doing a real push here into growth and our clients are pulling us there.
Andrew, can't wait to see what you guys pull off in 2022. I know you've been playing your cards a little close to the chest as you just finish all this off, but with that kind of team, board directors, advisory, management team, and Bloom Health now is one unified platform. The client, I mean, the sky's the limit in 2022. I can't wait to see what you guys pull off. And it sounds like hopefully we're going to have you back on a couple more times before the year is over, because it sounds like things are brewing. So I can't wait to have you back, hopefully, to report on some nice wins and some other great stuff.
Looking forward to it.
Thanks for joining us, Andrew. Good luck.
Thank you.
For everybody at home, you've been watching or you've been listening to my podcast on Spotify, Google, Apple, your favorite podcast platform, to Andrew Morton, CEO of Bloom Health Partners, formerly known as Maitri Health Technologies, now trades in Canada under BLMH, for our friends in the US, MHTCF, and for our friends in Europe and Frankfurt under D84. You've watched or you've heard what Andrew has to say, the profile of the kind of clients that are there, the team that's sitting around them, the opportunity that's facing them and the kind of response they're getting already. Now you got to do your due diligence, and this is a great time to do it because it's all brand new. So make sure you get to the, I'm even going to say go direct to the Bloom Health, the Bloom website direct, because that's where the new deck is, the new presentations, all the new materials, and do a deep dive due diligence. Because if you believe, we all know that healthcare, especially in the US market, is a really big topic. So if you believe in what companies are going to have to provide to employees in order to get them in and win them over, and where health tech is going and Occ Health is going this decade, forget about just the next couple of years, then hopefully you discovered your next amazing small cap company and Bloom Health Partners. Thanks for joining us, everybody. Have a great day. See you next time. Hey guys, this video is over, but don't forget to help your company by liking it and even leaving a comment below. And then don't forget to help yourself by subscribing to our channel and never missing another great Agoracom small cap video.